I took my third year from computer engineering off to see, okay, what if my assumption about the world, that the world is made up of sort of engineers, and engineers need sort of some humanness to them. If that's correct, then I must be able to pursue some opportunities with that field, right? So, and I was lucky enough that at that time, Water was starting a program called Velocity, which sort of emphasized entrepreneurship, student entrepreneurship. So I became part of that, sort of unofficially dropped out of third year, and did a startup with a bunch of a bunch of my friends were also students. That didn't go anywhere, but it taught me a great deal. It sort of taught me the main thing that sort of I came out of that. Okay, engineering is about how to make something, right? But maybe a more fundamental question to ask before you depart on the journey of how is what is it that you should be building, right? And that to me is something I totally ignored for the last 20 years of my life, let alone what I do. So, okay, need to figure out how to make that happen, right? So I quit the startup and actually went back to school. This time I researched my degree into not only computer engineering, but also involved parts of electrical and mechanical, which were good but not as good as computer because that's my first choice. But the major change that I think really sort of set the course of my career and my life actually was I opted for a whole bunch of liberal arts and social sciences courses. So I started auditing courses in human-computer interaction, liberal arts, philosophy, psychology, social sciences, right? An understanding of how to have healthy habits. There is not, or there was not at that time, a lot of emphasis on that in the world. And we thought that's something that we could change. And it was sort of weird that there was no emphasis on it, because, well, 7 billion people in the world, and all of us do sort of 4 things every day, right? We eat, we usually stress about something or the other, right? We sleep, and whether we try to or not, we end up working out, right? Everybody walks 2 steps, right? So here are 4 fundamental human behaviors, and we have no idea how to actually go about, and I don't mean to say we have no idea how to optimize them, but there is no structured way, right? There's no institutional way as the medical system has become. There is no structure around what does it mean to have healthy health behaviors for you or me, right? And that's what we started to sort of look at and started to build. And this was like 2013 problem. So again, we sort of took our idea of, hey, fundamental thinking, applied it to all the user interviews we did, applied the technology we built, and finally figured out that, hey, guess what? There's actually a therapeutic process that all therapists, whether it's talk therapy, CBT, whatever, there's a therapeutic process that everybody follows, but nobody talks in terms of that. And it turns out, it's very simple steps actually. Number 1 is you gotta figure out what your triggers are, right? Triggers are things in your environment. It could be sort of thoughts, things in your environment, things you see, hear, whatever, that make you stressed. And stress, by medical definition, is whenever your flight or fight response is overactive for more than normal for you, right? Okay, let's figure out these triggers. Step number 2 is learn coping mechanisms. Coping mechanisms are things that you need to do or that you should do once your stress starts to get out of hand, so you'll sort of come back and you can sort of come back to your center, right? Once you have these 2 things figured out, number 3 things is to start changing your lifestyle to install good habits. Now, interesting enough for us, this is the first time it's been in interviewing users, interviewing sort of mental health, or not mental health, but healthcare professionals in general. It's the first time when we were exposed to the idea that, oh hey, habits are important, right? Habits are things that sort of just patterns in your brain and in your life that just form because of the stuff you do and the circumstances that you're in. But as it turns out, and I'm sure people here that sort of seen life sort of understand this at least subconscious level, but there's no structure around the world. There's no institution telling you should do this, right? Which is how we tend to absorb information. So we're like, okay, that's interesting. And so that's what we started doing. Now we have this app and sort of device combo. The device actually tracks you every second of every day. As soon as it detects that your flight response is sort of overactive, at that time it will sort of shoot you notifications saying, oh hey, something is going on. Do you want to take a quick note, or do you want to sort of do an exercise that we know has worked for you before, right? And in that way, you address that trigger directly. A therapist would actually ask you to, oh hey, at the end of every day, why don't you go write a journal where you sort of, this memory down for your day's events. But this way, you don't have to do that because half the people don't remember what happened in the day, right? This way, it tells you right then and there what is it that you should be writing down and what is it that you could do right now to alleviate that stress, right? And the cool part we're working on right now, and this is sort of, to me, is the future of healthcare. All of us are sort of very unique individual people, but at the same time, we have a lot of commonalities, right? So what if we could start clustering people based on some factors, right? Maybe age, maybe the locality you live in, but say, oh, hey, you know what? The last time when Joe experienced this, they tried this coping mechanism or recovery strategy or this intervention, right? And it seems like your sort of, body type is an 88% match with them, right? Is there something that you also want to try, right? By collecting data on many different kinds of people, doing undergoing many different kind of conditions, right? Using different kind of strategies to take care of themselves, we sort of start creating this social network, so to say, that actually starts sharing across people health knowledge, habit formation knowledge, and sort of medical knowledge, right? And that's something that we're seeing has not really been done before, and we're asking ourselves, like, why is that,